until recently.
And even trial vaccinations like the botulism
or pertussis
was done here and is still used from here, although the reserves are held down at the CDC.
Bob, can you maybe say a little bit about the process the department uses to recommend which vaccines should be given? I mean, this is something that the Department of Community Health generally would do. So, you know, there was a time when there weren't any vaccines, and then there were one or two, and, you know, now the list has grown, and that list is compiled by the department.
Sort of by the department. We usually, in fact always, take the recommendations from the CDC. There's an advisory committee that makes recommendations to the CDC called the ACIP. The ACIP recommends which vaccines and how they should be used based on the licensure. We normally accept which ones CDC recommends. We take those and we make those recommendations for practices within Michigan. So it makes it somewhat easier, but we, depending on funding, depending on other issues, we may tailor it just a little bit to meet Michigan needs.
We should probably mention, too, that in Michigan, and probably in most, if not all, states, there are going to be parents who object, who don't want to have their children vaccinated for, you know, whatever reasons. And even though these are strongly recommended, there is a way for parents who choose not to have their children vaccinated to opt out, correct?
Actually, we take the vaccines that are recommended by the CDC, and then a smaller subset of that get recommended, or we could even say required for school students for entry. And so I think you're referring a little bit to those entering school. And there's a waiver option within Michigan. If there's a medical reason that a child can't receive a vaccine, which happens, or a religious reason they can't receive vaccines, or some type of philosophical objection, they can sign a waiver that then they can be allowed into the program without having the vaccine.
The rate of vaccination is fairly high for the ones that are required for school entry. I mean, some people choose this waiver option, but it's a small number generally.
I think that's one of the advantages that we found with MICR, is that we have made huge strides forwards on getting the immunizations out there and increasing the rate of children that have been appropriately vaccinated at the right age time.
And of course, the effectiveness in a population is going to reflect how many people actually receive it, right? I mean, you're going to have better results if you have a larger number of people receiving the vaccines.
And, you know, it makes a big difference. A lot of times people don't realize that when we're vaccinating, this is something that's really public health, in the sense of we're trying to help the general all over public and the health. And so some of the certain things like rubella vaccination that men get, the effect that a rubella disease would have on men would not be near as severe as it would be for pregnant women. And one of the reasons to vaccinate men is to protect women from this virus. Same thing, another one with pertussis, whooping cough. It's very serious to the young child. And so getting the new vaccine that we just talked about, the Tdap, which is a pertussis that is given at a later date for adults, really is not as much for the protection of the adult, although that is a benefit, but it's for the kids that are around them. So sometimes what we call herd immunity.
I think herd immunity is a really important concept because we know that vaccines are not 100%. If something like measles, we've done a great job at assuring that kids are vaccinated with measles vaccine, but we know that one dose is going to protect about 90 to 95% of the kids, and 2 doses is going to protect between 95 and 98% of the kids. But there's going to be 2% of the kids, and any that have objected to it, that wouldn't be protected. And we rely on the rest of the population to be immune so that the spread of the disease can't occur.
What about families that maybe they don't have health insurance or their insurance doesn't cover vaccinations? What happens with their children?
You want to talk about vaccine for children?
Sure. A federal entitlement program that is available, and when I talked about the distribution of the vaccines earlier and the amount of vaccine that Michigan Department of Community Health distributes, it's really a federal program where we obtain vaccines for eligible kids. And it's going to be birth through 18 years of age are eligible, who are either enrolled in Medicaid, uninsured, underinsured, and seen in a local health department or a federally qualified health center, and then a Native American or Alaskan natives. Those four groups really of individuals qualify for the vaccine at no charge for the cost of the vaccine. There may be an administration fee. So that gives us a big leg up in assuring that the population can afford vaccines and stay in their medical home.
And this is federally funded largely?
Primarily federally funded, right.
And it would be administered, say, in Kalamazoo through the county health department? If I didn't have insurance but I needed my children vaccinated, that's where I would go?
It's one of the beauties of the program is you can get that vaccine for either in your physician's office or at the local health department. We currently use the local health department as the repository for the vaccine. They get it and they distribute it to the physicians that participate in the Vaccines for Children program. Mm-hmm. That's the name of the federal program. So actually you get to stay in your physician's office and still receive the vaccines.
I think one thing that's interesting and probably important to get out to your listeners is that the Vaccine for Children's program is very well known by the pediatrician community, but not as well known by some of the other physician populations. By the anesthesia or the obstetrician community or something of that sort. And as they're dealing with certain new vaccines like the HPV vaccine, which might be brought up to an obstetrician first instead of the pediatrician or something of that sort, that those are available through the local health department.
Okay, that is good to know. Sure. And you mentioned, Dr. Holtzman, the HPV vaccine. We should talk about that just for a moment. There's been a lot of attention to that recently in the news, and this is really a medical breakthrough, right? I mean, to have a vaccine that potentially could prevent cancer, that's different from many of these others which we've talked about, which are, we're primarily talking about, some other infectious disease.
Yeah, it is a big difference. Really, the only other vaccine like that has been the hepatitis B vaccine, which is also helps protect against liver cancer that is secondary to a virus. But this is a virus that causes cervical cancer and an increased risk, and it has made a big difference on the number of there's many different HPV viruses that can cause cancer, but this gets about 70% of the cancer-causing virus at this point in time.
This whole idea that a virus can cause cancer, be it hepatitis B causing liver cancer or HPV causing cervical cancer, that whole concept, that's something just relatively new in the last few decades, right?
Yeah, it's a lot of things that are coming on. Another one that's interesting, and I don't know where they are in the vaccine, maybe Bob knows a little bit more, but Helicobacter pylori, which I'm sure you're familiar with, causing gastric ulcers. Sure. There's talks about a vaccine for this. So it's the whole concept of where vaccines have gone and where we might be going in the future is really an exciting time in the medical field of what this is good primary prevention, getting something before it ever happens, which us in health like to do.
The HPV issue has reminded me too that most of the focus has been on cervical cancer, which is appropriate because that's probably the most common and serious consequence of HPV infection. But yet I know from my medical practice that there are other consequences of HPV that can be very serious. One of them is respiratory papillomatosis. It's a growth in the throat of newborns and children who contract it from their mothers. And then another, it's been in the medical journals some recently, is HPV as a causative agent in cancers of the throat. So it isn't exclusively cervical cancers, but other disorders as well, correct?
Yeah, I think we're learning a lot more.
And there's been some controversy as to whether the HPV vaccine should be required for school entry or not, but just kind of to update the viewers, the Senate recently passed a measure that would say we recommend the HPV vaccine